Do you have pain in the front of your shoulder that is worse with lifting, pulling? Well, you may be dealing with bicep tendonitis. Hi, I am Dr. Sebastian.
And I'm Floyd, the PA working here at Integrative Rehab Medicine.
Today we're going to talk to you about bicep tendonitis. So Floyd, what is bicep tendonitis?
So bicep tendonitis is going to be inflammation and degeneration of that bicep tendon, specifically where it goes into that shoulder joint.
So it is an inflammation, but also there is a tendinosis, correct? So we can call it tendinitis, but some other doctors sometimes call it tendinosis. What does that mean?
So that means where the inflammation has been present for a long enough period of time that you're actually seeing degenerative changes in that tendon. So they can be small tears. Sometimes they don't even show up on imaging, but that's the idea.
So bicep tendonitis or tendinosis, similar, but what causes bicep tendonitis?
So biceps tendonitis is going to be from overuse injuries. It's going to be repetitive motion. So imagine lifting something repeatedly over time or doing overhead work repeatedly over time. Something like installing cabinets. Those types of activities are going to typically cause it.
So overusing that bicep tendon can increase degeneration of the tendon and inflammation. Also, when people have instability of that shoulder, the bicep can get injured as well, as the bicep tends to sit in front of the shoulder joint. So if the joint is a little bit unstable, it keeps on hitting that bicep tendon and stressing it and also contributing to bicep tendonitis. So what are some of the common symptoms of bicep tendonitis?
The most common symptom is going to be pain, especially in the front of the shoulder. Sometimes it can radiate down a little bit farther than where the actual injury is. And that pain is going to typically be there, again, with some type of lifting, some type of overhead activities. Those are going to be the things that you're typically going to feel.
Yeah. You can also feel clicking and popping or even sometimes weakness of the shoulder. So bicep tendonitis can cause an array of symptoms, but they are usually mostly in the front of the shoulder. So how do we diagnose bicep tendonitis?
Most important thing is to do a really good physical exam. So as he described, pushing on that area, if that area is very tender, that's a very classic sign. It should not be a tender area to push on. The other thing is doing what's called the speeds test, where you have your arm extended and pushing down. If that causes pain in the arm to give out, that's a positive sign that you're dealing with biceps tendonitis.
Okay. And beyond physical exam, we can also do an ultrasound. We can do that right here in the clinic, where we scan the area with an ultrasound and you can see inflammation or fluid of the bicep tendon. Or sometimes we can even use an MRI to really diagnose it as well. So unfortunately, there's some treatments out there that may not be the best for bicep tendonitis. Like getting a steroid shot in the bicep tendon is typically not the best idea, as the steroids can actually degrade the tendon even farther. So there are better treatments. Here at Integrative Rehab Medicine, we focus on regenerative medicine treatments. So what are some of the regenerative medicine treatments that patients can seek?
So the most common way they're going to be treating this is with something called PRP. PRP is platelet-rich plasma. So it's where we take your blood and we have a lab and we process it and we make this high concentration PRP. And that's what we use for the injections. Basic idea is it's causing a brief amount of inflammation, and then the body is going to heal from that. And it's going to actually make those tissues healthier and stronger over time, instead of having these degenerative changes that you can see with the steroids, like what he described.
Excellent. So the PRP can actually help you heal the bicep tendonitis, but very often we need to do other things. We need to focus on some of the shoulder mechanics. So that's done with physical therapy. So typically PRP is combined with some physical therapy and maybe some laser treatments. Putting all of those treatments together can actually heal the injury for good. So if you are interested in finding out more about bicep tendonitis or any other shoulder conditions, just follow the link below and visit our website.